why we're having this conversation is because Anonymous sent us an email saying, "Hi Ndombi, I just wanted to hear an expert's opinion on the matter of co-payments and medical aid. I'm currently going through the admin process of having my son admitted for a minor medical procedure. But even with medical aid, I still have a lot to pay, which honestly, I just can't afford. Please get an expert that can possibly further clarify how medical aid schemes work, because this is frustrating." And we've got exactly that. We've got Dr. Toko Potelwa, who is the executive member, protection at the Council of Medical Schemes. Good morning, Doc.
Good morning, Tabby. How are you?
I am dark and lovely. How are you?
I'm fine, thank you. Thank you for inviting me to discuss this topical issue.
Sure. It seems like a lot of us don't understand how medical aid works, and we get the rude awakening when we get admitted to hospital, and now we are faced with mountains and mountains of bills, thinking that, no, but I've got medical aid, I should be fine. Please take us through the concept of co-payment where hospitalization is concerned, Doc.
Okay, thank you, Tabby. I will first explain how members should be choosing the right scheme option for their family needs.
Yes.
It's important that whether a person uses a broker or they go directly to the scheme, there is an explanation about their benefits, the contributions, the limitations, what we call designated service providers, exclusions, and understanding the co-payments.
Yeah.
So what we normally have as part of the rules and benefits of the schemes is that the schemes will nominate what we call these designated service providers and negotiate on behalf of their members to ensure that they manage their funds appropriately.
I see.
It's important for members to know where or the proximity of these DSPs.
Yeah. Now,
for their sake.
I see. Now,
Yes.
Anonymous would like to know how medical aid schemes work, and how would you simplify this for her? And I'm assuming you've just answered that question, that we need to get in touch with people who understand how these schemes work better, you know, someone who is informed and is in the industry.
Okay. As I had already mentioned, yes, with the DSP, your brochure, or when you take on a medical aid, your broker should explain all those limitations that might be there, the co-payments, and when the co-payments will not be there.
Yeah.
So in a case where you go to a designated service provider or a hospital or a doctor or a surgical clinic, specifically for this member spoke about a minor procedure. Unfortunately, I don't know what this minor procedure was. But schemes normally negotiate on behalf of their members to say, for this, I will take a procedure like maternity. Let's take someone who's going to deliver. They will give you 3 days in hospital and say, for this package, this is what we've negotiated with these list of hospitals. So you have to use these hospitals, then this is what we will pay, and you will not have a co-payment. But if you don't adhere to the rules and you go to a service provider that is a non-DSP, then you fall into that trap of now having to pay for a pay the co-payment because you haven't gone to where they've negotiated. So you'll end up paying. They will have either a fixed fee as a co-payment. They will either have it as a difference between the actual expense and the scheme rate, or it will be just a percentage of the account. Then they will create that co-payment out of that. And for those DSPs, if your condition is a PMB, that's the other thing that members need to understand. If your condition is on the list of PMBs, and you go to a DSP that your scheme has informed you about. When you pre-authorize for this specific member, she called the scheme for the minor procedure to pre-authorize. They would have told her, this is the DSP that you must use. Then, if the condition is PMB and you've used the DSP, you won't have a co-payment.
Doc, the terms that you use can be a little bit, a little confusing. So please explain to us what PMB is and what DSP, I think, is.
Okay.
Yeah.
Let me start with PMB.
Yes.
When you register in a medical aid, there is a list of conditions that schemes must pay in full. No matter what.
Okay.
So you have about 26 chronic disease lists. In that chronic disease list, you have all your common conditions like your hypertension, diabetes, asthma. So it's a 26, or including COVID. We included COVID when we had COVID. Then you have another list which is called DTPs, about 270 conditions. Yes.
No.
So all those conditions must be paid by schemes in full. So in that, schemes will develop protocols for each condition or a policy for each condition. For instance, they will have a policy of this is the consult that you must do, these are the tests that you must do, these are the medicines that you must take. Then they create a formulary for that condition. So those must be paid in full. And if you have queries or challenges, then you can go back to a scheme to ask them to assist you on what the rules are with regards to PMBs and what it is that they should be able to give you the list of medication that you must look at.
And DSP, I'm assuming, is designated service provider?
DSP is designated service provider.
Okay.
There they will have contracts with different GPs, different specialists, different hospitals. And in that, they have negotiated rates for this list of PMBs. Sometimes over and above this list of PMBs, so that they are able to manage their funds appropriately and ensure that members still receive quality health care within the contribution that they make, looking at that fund as a fund for the whole population of the scheme.
Okay, I think I get it. Now, Doc, what is the difference between medical aid and health insurance? Because some people only find out once they're admitted to the hospital, or rather they want to get health care, that no, you're on a medical insurance versus a medical aid. They think that they are, in a medical aid, or they have a medical aid. What is the difference between the two?
Okay. Let me start with the health insurance.
Yes.
For instance, when you take your own insurance, whether it's a home insurance or a car insurance, there are specifics that are there.
Yeah.
So in the healthcare insurance industry, there are products that slightly cover some conditions, not like a medical aid where you have this PMB list and the 270 conditions. So in the healthcare insurance, cover will be once you are sick and you are in hospital for more than 3 days, we will pay you out for each day after the 3rd day.
Okay.
So it does not cover everything.
Okay.
It's sort of a supplement to what you would have had. But it also depends on the member, because we tend to feel that when we are younger, we are invincible. We're not going to get sick. So you will opt for what is cheaper, which is healthcare insurance. But now when that major event happens and you end up in hospital, yes, the costs are going to be high, but there's a set fee even for that day 3 that after day 3, we will pay you, for instance, if you are in a major event, let's say they will say we'll pay you 10,000. If it's not a major event, 5,000 per day. But the hospital costs that you will incur are much more than that.
I see.
So normally that is used for sort of topping up what you already have.
I see. Doc,
It might not cover your consultations and other things. It's just a fee that for each day that you're in hospital, this is what we will contribute.
It's an insurance, basically.
Yes.
It's an insurance.
Yes.
Now, Doc, do you find that, with the state of the public health care system, that medical aid scheme companies are taking advantage of the consumer? Are you finding that a lot of people are coming forth complaining about, that this has happened to me, here, my co-payment, here. Is that what you're finding? And is it because of the fact that the public healthcare system is in the state that it's in?
Let me answer that question with regard to consumers and medical aid.
Yes.
Yes, we do get a lot of complaints of members that feel that they are not getting what they should be getting. But it's also important that members are educated before they commit to taking that medical aid.
Yeah.
What the tendency is that someone goes out there, whether it's an employer or you go out on your own looking for a medical aid, you use a broker or you go directly to a medical aid. The broker will look at what you earn, look at what they think you can afford. They don't ask you about what are your family needs. Or they don't look at your age. They just look at what you earn, and they sort of decide on your behalf.
Yeah.
So members should actually sit down, decide. These are the things that might, for instance, let's look at a young family with let's say people who are newlywed. They're still looking at having children.
Yeah.
So they should look at that. Maternity needs.
Definitely.
They should look at, yes, they're still young, but they want to keep healthy.
Yeah.
So they must choose an option that will look at their maternal needs and some major events. Yes, they might not have chronic conditions as yet.
Yeah.
But the tendency is people wait until someone falls pregnant.
Hey.
Then they want to join a medical aid. Unfortunately, there's going to be a waiting period.
Yeah. And with someone who's much older, then you can look at like chronic illnesses because
you look at your family history first. You look at your chronic illnesses that you have. You look at what are the other common conditions that are out there, because you might be healthy, but you might not know that you've got, let's say, a condition that will just crop up without you knowing, let's say cancer, oncology. So you must think at an older age, you must think of all the possible things that could happen.
Yeah. Doc.
And make sure that there's comprehensive cover. If you cannot afford that comprehensive cover, you can use the top-up, like go to gap cover or health insurance, to ensure that when that incident happens, if you know what the limits are in the option that you've chosen. For instance, I'm looking at oncology for someone who did not expect it. Let's say if your limits there are half a million, and you have a condition that goes above that, at least you have a top-up on the side, some form of insurance that will be able to cover that condition once you've reached the limit. So it's important for people to look at all those exclusions, the limits, what co-payments are there, where are the DSPs, and look at the medical aid brochure that you are given. It is the duty of the broker to educate the member to know what they are choosing.
And it is also the duty of the member to empower themselves with knowledge by
Yes.
asking questions. Doc,
Yes.
thank you so much for giving us your time. You did give me a little bit of clarity, and I think after this conversation, I do have to sit down with my broker and have a detailed conversation so that I can understand my benefits much better. Thank you so much for your time.
Thank you, Tabby.
Thank
Enjoy your
you.
day.
Thank you so